Hello everybody again, take two. So I'm Taylor and this is Steph, and we're two of the nurse practitioners here at Lenox. Oh, there we go. So yeah, if we want to go to the next slide. Or Christy, you'll do the slides for us, right?
Yes.
Okay, can you go to the next one? Yeah, sorry.
Oh, hold on. I think it paused for some reason. Okay. I don't know why. Let's try this again. Oh, goodness. Sure. Slideshow. Huh. Okay. I will just make my screen bigger because I don't know why it won't let me go in presentation mode.
At least it's not just us.
At least. Yeah, it's not. Okay.
So do you want to start on the second slide?
Yep. Okay, so we thought we'd introduce ourselves. I think what makes us unique in speaking to you is that I come to this talk with many years of very different experiences. I graduated Boston College in 1993. That was at a time where it was impossible to get any nursing job. You couldn't get a job in a nursing home, a rehab facility, let alone a hospital or any floor ICU of your choice. You know, I worked down at Johns Hopkins for many years. Started to get a little more interested in going back to school. I sort of have a very curious, restless mind. And so I knew that University of Pennsylvania had a couple different programs that I was interested in. So I started working in Philadelphia at the University of Pennsylvania, the hospital there, where I eventually got my master's in healthcare administration through the nursing school and the Wharton School of Business. And then my acute care nurse practitioner as well through the nursing school. And all during that time, which was probably the happiest, sort of one of the happiest times of my life, aside from, coming into Lenox and joining the team here, I really got to explore a lot of different career positions. So just to highlight a few, I was a nurse in the neuro ICU. I then ran all the ICU clinical research trials out of the ICU for neurosurgery. And ultimately, when I graduated with my NP, then I was the lead NP in the neuro ICU and helped develop the neurocritical care team. And then I found my way up to New York. A theme that Taylor and I will often refer to is really relationships and keeping relationships. Dr. Langer and Dr. Bookvar both did their fellowship at the University of Pennsylvania, and we all overlapped and worked together, and I maintained contact with them. And so when the opportunity to become the supervisor to the NPs here in the office and to work with them, I jumped at the opportunity, and this is where I am now. Hand it over to you.
Thanks, Steph. So I'm Taylor. I'm also one of the nurse practitioners here. I have more of I've just went from place to place with graduation of degrees. So it'll be interesting because as we go through the talk, you'll kind of see that there's a lot of different opportunities within nursing, and there's a lot of paths you can take to kind of get to the same place or different places. But I graduated from Binghamton University, which is upstate New York, in 2016 with my undergrad in nursing, and I worked on a neurosurgical step-down unit at Columbia Presbyterian for 5 years. I worked there in a neurosurgical unit, actually. And we'll get into, how we got into those positions and different opportunities within nursing. But while I was there, I also became a nurse preceptor, meaning I educated and helped orient new nurses when they were coming to work with us, and also the charge nurse of the unit, where you're kind of like the lead head nurse. And you, rather than having your own, nursing assignments, you kind of help take care of the whole floor, and you're that go-to person in emergency situations, responding to codes and rapids and things like that. While I was there, I went to school for my master's, which I did at PACE, which is downtown Manhattan, and I graduated with my family nurse practitioner degree. And then I came to Lenox, which was my first nurse practitioner job here at Lenox. And I primarily work with Dr. D'Amico, who you guys have hopefully met before, who's the director of brain turns. But so I primarily work with him here at Lenox.
And you guys overlapped at Columbia, right?
Oh, yes. And
relationships.
Yes, exactly. So I overlapped with Dr. D'Amico at Columbia while he was in residency there. And so that is just like Steph, her bridge here was my also bridge here through that. So it's great. And like she said, to just keep, connections are very, very important, good relationships, because you never know when someone can help you or you can help them in the future. So, we just kind of want to give like a brief overview first of kind of, what nursing is, and then we'll kind of get into more specifics, nursing and neurosurgery. But nursing responsibilities can vary a little bit state to state and country to country, but here in the US, nurses are, we have the brief overview, but patient care. So nursing provides direct care to patients, including administering meds, vital signs, and performing medical procedures. So, as an example, you think of the bedside nurse who is helping to check the patient's vital signs, give medications, kind of carry out the orders of the physicians and the care team.
I want to add, patient care, especially at the bedside, like you're the eyes and ears, and you're like, when you think of first responders, like it's you, right? Like you build your skill set, call it spidey senses. You also have your academic knowledge, and you kind of like marry that all together, and you are the first to notice those subtle changes, blood pressure changes, someone maybe not talking as well as they were earlier in the morning. So that, never really underestimate the value of patient care, because you're really, first line responders and the heart of kind of everything that's going on.
Yeah, exactly. So you're the one who's spending the most time with the patient. So, assessment, diagnosis, you're doing your assessments, head to toe assessments. And as a nurse, especially a bedside nurse specifically, you're spending the most time with the patients. So like Steph said, your spidey senses, you may notice this doesn't look right, or this patient seems off, and I'm not entirely sure why, but something's wrong. Like, let's try and figure, what's going on, and start going through your checklist of things. But you help gather medical histories. You collaborate with other healthcare professionals as a nurse, including the physicians, social workers, dietary staff, nursing attendants, and you help develop treatment plans. So, a lot of times, especially nursing school, you hear like nursing care plans.
They're painful, but they're for a good. They're for a good.
And basically, it's like you're thinking of all the problems that the patient may have, so to say, and then the steps to help it. So, okay, they're bedbound, they're not really moving a lot, or they have all these drains and tubes attached to them from surgery, and they can't get up and walk. So, like, what are we trying to think of nursing? Oh, let's help move them from side to side, or passive range of motion to just keep, to prevent deterioration and just prevent bed sores and things like that. So that's just that's a basic one, but for like every problem they have, you're kind of thinking, what can we do as a nurse to help them? Health education. So throughout the entire course of any treatment, you are educating the patients on the meds, side effects to look out for.
Yeah, I think education can actually be one of the more fun aspects of the job. It's really that time where you can, in a sense, like shine, like you have all this information, you have forged like a relationship with the patient, and then you're getting to send them on their way. So you're empowering them to care for themselves. And you're definitely like a pro education, patient advocate, patient teaching. Like I think there's a lot of value in that. And so we do that in the office as well. As NPs, but we can get to that later.
And along with that advocacy, like exactly, besides education, you're advocating for your patients, you're making sure, you're spending a lot of time with them, you have those building relationships with them, they may be telling you, I feel a certain way, or I don't want this, or I don't understand this procedure I'm told I have to do, and like you can advocate for them and help get them answers and just speak up for them. Coordination of care kind of goes in hand with that. You're just going to help coordinate physical therapy, all the different care teams, and with each other. Emotional support, just generally being there with them, helping them, their family. It can be very stressful no matter where you are, hospital, office, anything. If you're seeing a physician, a lot of times it's for a reason.
I hope you don't mind me bringing this up, but even prior to hopping on this call, Taylor and I were speaking about emotional support and how there are times where, we're involved in emotional support. But Taylor was just saying, even last week, there was a neurosurgical patient who started having life-threatening brain bleeding, and her and Dr. D'Amico kind of ran up to the hospital to be with them. And, the daughter wasn't there and the mom was going to have to be taken to surgery. And, even though Taylor's not the nurse that was caring for the patient, on that shift, still when the daughter came in, she was there. She was that person that, that the family remembered from the office, and she was there to comfort and provide that support for the patient. So it kind of like sneaks up on you in all different ways, being the support for families and patients.
Yeah, for sure.
And it's okay to cry.
Yeah. And then just documentation. There's always that rule: if it wasn't documented, it didn't happen. So we always, it's nursing responsibility to document all the things you did, or education you gave, or conversations, things like that. So how to become a nurse? So either here, at least in New York, it's a Bachelor of Science in Nursing or an associate degree in nursing, and then passing your NCLEX exam, which is a national exam. Wherever you take that NCLEX exam, whichever state you sit to take the exam, you're licensed if you pass within that state. But then if, say, you want to transfer practice in another state, it's just a matter of applying in paperwork. You don't have to keep retaking the test.
And a check.
And money, of course, money. So, yeah, I know it's a little small. So, oh, thanks. So there's just so many types of nursing, and this is just some of them. There's, emergency room nursing, bedside nursing, which we keep alluding to, and within the hospital bedside, there's so many different specialties. Cardiac, neuro, obviously, oncology, peds, obstetrics, psych, and then within all of those as well, there's ICU level versus not ICU floor status, meaning you're not as in acute care. The nursing to patient ratio is higher, meaning a nurse takes care of more patients rather than an ICU where it might be 1-to-1 because they're spending so much time that patient's acutely sick.
And, this is, I've been in nursing a very long time. So clearly, I enjoy the profession and I'm quite passionate about it. But I want to say, particularly in this slide, that being a nurse is what you make of it. And just because, maybe you graduate and you go into the season of, I'm going to be a med surg nurse, or I'm going to be in the emergency room, life takes you where it takes you. life changes, family changes, your curiosity changes, you move. And so what I find so wonderful about nursing is it's so dynamic. Like you can do anything to fit your goals or whatever season of life you're in. And to that, I just want to kind of point out, like Taylor mentioned, like school nursing. I, have been an NP in neurosurgery for a very long time. But when I became a mom, it was, for me personally, it was a real challenge to keep the longer hours and to keep up with like literature and in services. Like I personally couldn't strike that balance. So I became an elementary school nurse, and it was one of the funnest jobs I ever had. And I'm so grateful that in our careers, you can kind of, move within all aspects of it, but then kind of return to your interest or whatever interests you later. Alternatively, like we have a nurse who works in our department, who, like, our department could not exist without her. She's so phenomenal at what she does. She's not an NP, she's a registered nurse. And her job is to collect all of the medical information, to review the medical information prior to surgery, and really help patients through that perioperative period. But for her, this is where she is. She loves her job. She's not changing. Her season of life is right here, right now. And she's in it for the long haul, and she's so good at it. And we couldn't do our job without it. So, it's not saying like you have to, change throughout your career. Just know that the options exist, and or you just find your passion and stick with it.
Yeah, and that's who Steph is talking about, that nurse in our office. Like, she was an ER nurse and then an ER charge nurse for years, and then she, like boots on the ground running type, and now she's, the more of like an office type style is like fitting her lifestyle. And so that just shows you like the variability within nursing. Like you can really do so many things and like what your passion is, and you can change 5 times or more.
Yeah, it's cool.
So yeah, school nursing. Oh yeah, okay, perfect. So so then there's nursing, and we're both nurse practitioners, but
different nurse practitioners.
Yes,
and we'll talk about that.
And from nursing, you can always just be a registered nurse. You never have to go past that. But just to talk about different paths within the nursing field, there are different master's degrees that you can get. Just like some of you are pre-med, where you get your undergrad and then you go to med school. Similarly, we can also go to higher education. And some examples are Master of Science in Nursing, which is a larger umbrella term. Like, I'm a nurse practitioner. I have my Master of Science in Nursing, but specific to nurse practitioner. There's Master in Education, where you would like to become a nursing professor or clinical instructor and teach at like the collegiate level, or as well as nursing education within the hospital. Most hospitals have nurse educators to educate the nurses on new like devices, or keep them up to date on the literature as it comes out, and treatment programs, things like that. Management and leadership nursing, where you are more on the side of like the nurse manager, or even higher up within the hospital system or office. And then nursing informatics. This is more new. Nursing informatics is really more on like the tech side, and kind of incorporating as new technologies come out with nursing. So certain examples to work in nursing informatics is they can work for like Epic or Allscripts, which are both electronic medical record systems. And as hospitals incorporate those systems, the nurses could go on site, or tele-wise, and just kind of train and help be a part of like incorporating those systems, or working with them as they're developing them. Like, hey, this looks great and it's pretty, but like it's not going to work for nursing because of A, B, and C, because they have that bedside experience, and they can kind of just help them, the people who are developing it. So those are some examples, and there are definitely more.
before we jump to the next slide, you know, Taylor mentioned with that first box, the Masters of Science in Nursing. So similar to like when a MD physician like specializes. So the MSN is like an umbrella, and underneath it are many different board certification tracks that you can do. In addition to what Taylor kind of listed below, but you know, it's pediatric primary care NP, which is an MSN, pediatric acute care, gerontology, acute care nurse practitioner, family.
Yeah, wait, Chrissy, can you go to the next slide? This will help.
Yeah. Okay, actually, we're going to go to the next one and then maybe jump back to that one.
Oh, there we go. Perfect. Okay.
So, you know, so under the MSN, these are all of the board certifications that an NP can have. And when you graduate from the program, like a family NP program or a pediatric acute care program, you do have your MSN degree, but then in addition, you have to sit for board certification within that subspecialty. And, you know, I sort of listed a number of them, and you can read them there.
And there's more. This is just some, but
right.
there's a lot.
Right. And, you know, so, and each state is, has their own scope of practice, which we're not going to get to just yet. That's the next slide. But, you know, your scope of practice, you know, sort of states what you can do and what you can't do with your board certification. And in New York, or particularly in this office, you know, we really kind of ride the line between sort of like adult like neurosurgery primary care and like the acute phase of the illness. And so Taylor has her family NP, and so I'll let you talk about family NP.
Okay, so I'm trained and certified to take care of from birth to elderly geriatric population. So just, we call it across the lifespan. Typically when something gets very acute on any of those levels, then it would go beyond me and more to an acute care within that patient population. But in general, it's across the lifespan.
And, you know, in addition to an office setting like this, where you might find family NPs are in like a primary care setting, right? Like where you could really take care of patients kind of soup to nuts in their age group. I'm an acute care NP, so I have to take, my specialty is everyone 18 or older in the acute phase of their illness. And you know, my partner in this department is Dr. Langer, and Dr. Langer is a general neurosurgeon. And so occasionally he does see pediatric patients. And then, because I have to know, which we're going to talk about in a second, my scope of practice, I pull in Taylor, and Taylor sort of backs us up with ordering documentation, reviewing images, making plans and whatnot. So it's just a reminder that, you know, you don't have to be just one subspecialty in a practice. Like you can really kind of work it to what makes sense, but then you also have to work very like collegially with your peers and know your scope of practice of what you can and can't do. Do you want to add to any of that? So you can go to the scope of practice, which is the one before it.
Back. Sorry. Yeah. Okay. Perfect.
Okay, so you can talk about New York.
So NP scope of practice varies a little bit state to state. But here in New York, so we have, we're completely autonomous as nurse practitioners for our first 3,600 clinical hours, which comes about to be like 2 to 3 years of practice. We're supposed to have a written agreement with a collaborating physician. And that just kind of, you can create it yourself or like follow a standard one, but basically you create it that just talks about like your scheduled check-ins. You kind of just have someone as your go-to person who's a physician to just be there as a support within your first years of practice, and not just any physician. So
it's like a mentor too.
Like, yeah. So you can't just be like, oh, I want to work in neuro and my friend's a doctor and over in, I don't know,
Poughkeepsie.
Yeah, in cards. I'm just gonna have them be my person. Like, no, it should be someone like within your your specialty who you can, run things back, bounce ideas back and forth of something like that. And just they're collaborating with you. But after you've reached that 3,600 hours, can practice completely autonomously. And so some of those things, meaning like prescriptive authority. So we have full prescriptive authority in New York State, meaning we can prescribe medications, any diagnostic tests like x-rays, MRIs, CAT scans, anything like that, as well as administer treatments. And with that means we're also responsible. So anything we order, we also are responsible for obtaining those results, interpreting those results, and treating. And if it's not something that we are, trained to do, then it's our job to make sure that they're set up with someone who is.
Like I'm not ordering a cardiac stress test.
Exactly. So
or I might, but I'll just make sure they're going to follow up with their cardiologist.
But we have the ability to order those things, and you have to be mindful. And this is what part of what you learn in school. You can't just order whatever. You have to have a reason for ordering scans. You can't just say, "Oh, I just want to make sure everything's okay. Can I have an MRI of my body?"
Well, this is actually so timely. So this is actually really important, and this definitely plays a part in your day to day as an NP. So something that we do in the office is, like we'll order brain MRIs or brain MR angiograms. We're looking for vascular abnormalities, or we're looking for tumors. But in our documentation, we think about those care plans that maybe you aren't doing in school right now. You have to sort of say, this is the problem. This is what, this is why I think it's a problem. This is what I've seen. This is my evaluation. This is my physical evaluation. And because of that, we're ordering this test. Because a lot of times what happens if your documentation isn't amazing, or maybe it goes a little outside of an insurance algorithm, they deny the test. So even though you may think oh my God, every brain tumor patient needs an MRI, they may say, yeah, but they don't get it for 12 months from now. So you really have to stay on point, be very methodical with your thinking, with your documentation, because as Taylor was saying, we may think oh, I'm going to order this, but there are other hoops that you need to jump through to get that executed.
Yeah, and that comes down also to your critical thinking. When you have a problem, you always have your top differential diagnoses of what you think it is, and the scans that you want to do, or labs or whatever, to rule things out and kind of go down the line. So it's important you take your knowledge and your background, and you're always thinking, and all the systems connect, right? So Steph, who does a lot of vascular, if they're having stenosis of things in the brain, she's thinking, okay, well, if there's problems here, there's likely problems systemically. Let's also, make sure we're looking at their cardiac and things like that. So you always have to be thinking. A lot of times in school, you learn system by system, and then when you are practicing, that's when it really comes together, and you're
the knee bones related to the hip bone.
Yeah, not just so it's important. Primary care specialty, we kind of got into that. NPs can treat both primary specialty services, and you're kind of trained within where you're practicing. And then again, patient education and advocacy. So NPs play a vital role in educating patients, just like we do in nursing. But as an NP, you kind of take it to the next level a little bit. And you can, talk to them about disease prevention, health management, and also helping them manage those things.
Right, like writing prescriptions, writing for therapies. Because now as an NP, you're at the ordering diagnostic level, and so that's where the education then goes to.
Go to the next slide. So how do you choose? It's the biggest question, and sometimes people change. So the biggest thing I think between nursing and then nurse practitioner is that when you get your nursing degree, you can take it anywhere. You can switch between cardiac, neuro, this and that. And as an NP, you can still have
a little wiggle.
A little wiggle. But the difference is, do I want to have my degree in family NP or acute care NP? It's a big decision to make, and that's a personal one. But things to think about are, what kind of patient population do you want to take care of? What are you interested in? Are you drawn to certain populations? What type of working environment do you want? Meaning hospital, outpatient, community, like hours, things like that. It's all kind of comes into play when you're thinking about that. And then, of course, the job market and demand. So you can, search. I think I'm interested in cardiology. Is it better to be an acute care NP or primary care, like different types of things like that? So definitely research and deciding on what type you want to do. It's important, and you can always go back to school and get more. So I had my family NP, and I have a lot of the basics. But if I wanted to say go back and get my acute care NP, I wouldn't have to repeat the whole schooling.
Right.
It's just kind of you're repeating the second portion with some extra clinicals. But you can always go back and add or change.
I'm halfway through my family.
Oh, I didn't know that.
Yeah. It's on pause at the moment.
Bingo. So now, we gave the overview, kind of like nursing and nurse practitioner, but now specifically neurosurgery. So exactly. So what is neurosurgery? I know you guys, you're in your second week of your program, so you've kind of gotten lots of information about different things, but things we do, things in neurosurgery that you're thinking about when you want to work in neurosurgery is obviously brain tumor, spine, pituitary, cerebrovascular, which is an entire thing in itself. Epilepsy surgery, facial pain surgery, hydrocephalus, gamma knife, neuroendovascular. There's a lot of different things, and within neurosurgery, you can also, choose. So we're both neurosurgery NPs, but Steph has a different focus than I do.
Yeah. So, I work with Dr. Langer, and as I mentioned, his practice is general, meaning he is involved with most of what's listed here, but he is known for his cerebrovascular like surgery techniques. He does open surgery, and he also does endovascular, which is like angiograms and coils. So, I think, I keep saying, and I'm in the middle of clinic today, so I'm just thinking of what I have ahead. He does it all. And I think, for me, having many years in neurosurgery, I was truly happy to take on a practice that was so general. For me, I never really know what's going to walk through my door each day, and I'm okay with that. Starting out, if I had gone straight into an office setting, I'm not sure I would have done that. There's so much to know that I think I would have maybe aligned myself with a physician partner that maybe was a little more focused. That's just me, like that. I know myself. So anyways, but that's what I do now. And Taylor works with Dr. D'Amico, who has more of a focus.
Yeah, and so Dr. D'Amico's focus is specifically, he's the director of the brain and spine metastasis program here, but so his primary focus is tumors, both that came from the CNS, but also metastatic tumors that were other cancers that came to the brain and spine. So we primarily deal with just tumors and less vascular. And
like neuro-oncology too.
Yeah, neuro-oncology. And I think what's great when you kind of specialize is I have my family NP, and you have your broad knowledge of everything. But then when you come into a specialty like this, you can really do your homework and research and learn the specifics to that, and stay up to date on what's coming out. And it's great because there's quite a few NPs in our office, and we all have kind of become champions in what we do, and then we lean on each other
I was just gonna say that.
Yeah, when we need.
Yeah. So, so like I'm general, right? So like I have my hand in every cookie jar, but that doesn't mean like I'm, an absolute expert in everything. And I will often go to my NP colleagues in my department. If it's a neuroplastics question, I'll go to, Elizabeth who works with us. If it's fine, I might go to our NP, and run a question like, do you think really like getting a CAT scan for this spinal issue is the direction I need to go? And we'll like talk about it together like colleagues. And, to that, I think it's really important to do the best you can to put yourself in a working environment that is supportive and collegiate like that, because the job's hard, and it's really good to have people around you that you can kind of bounce different things off of.
Yeah, and you're responsible. So you're responsible. There's a patient on the line, so you want to make sure when you guys are entering the job field in whichever realm you are, that when you're looking at different positions and jobs, that you ask the questions, are you going to have the support you need? An interview is always two ways. And so it's important that you feel that you are choosing what's right for you and that what they're giving you is what you need. So it's always important to remember that no matter which field you go in, as you look at different, fellowships, internships, things like that.
Yeah. It's interesting, like along those lines, it's a relationship like any relationship. Like you need to be seen, you need to be heard, you need to, and with that comes like, how can I ask questions? What kind of support is there for me? What would a day look like if I'm struggling? Like how does the office respond to that? Who's my go-to? And yeah, just what Taylor was saying, like, you really try and know yourself the best you can, and, your weaknesses, your vulnerabilities, your strengths, and make sure that, that's all brought up and talked about, and make sure that whatever environment you're stepping into can meet that. I think it's, well, okay, that's all I was going to say for the moment.
All right, we can go to the next. So, we've talked about this a bit, but just it's specific to neurosurgery, preoperative, intraoperative, postoperative care. Preoperative involves both elective things where patients are coming into the office and planning for surgery and education, prepping for surgery. That falls on, us as providers, as well as Meredith, who we've spoken about, who helps us gather all the medical information in preparation for surgery. And then there's also things that are coming through the hospital, through the ER, that you don't have as much prep and they're more of an urgent case. But just getting baseline assessments and preparing. Intraoperative, that this is also, besides the surgeon, you have the OR nurses who are there with the surgeon, who are in the operating room with them, and then also like in the hospital after, making sure their vitals are stable after surgery, their medications are given, watching the surgical incisions, and post-operatively, same thing, pain management, wound care assessments, both while they're in the hospital and then when they go home. A lot of times, because we work on the outpatient side here, we're calling our patients, checking in with them, making sure everything is okay. Is there anything that we need to bring them in sooner for, making sure they got all their meds? Because if they didn't and they just had surgery at like a tumor and then they didn't pick up their anti-seizure med, they seized. You have to be thinking about all these things.
Yeah, and so recently, there's also like bigger health-wide and hospital like initiatives, and so as NPs, you're also supporting those various initiatives. And I was just thinking of like post-operative stuff. So, within the last couple years, but it's really sort of honed down to what specifically we're doing related to like readmission, infection. Why are people coming back into the hospital? And, you might think, well, that's not such a big deal, right? Like if they need it, they come back to the hospital. But, for hospitals, if patients are readmitted within a certain time frame, then the department, like us, we have to pay that hospital bill for everything that's done. So that's a big ding, right, for us and for our revenue. And even like insurance tracks that. And so when we are looking to align, like as a department, align with certain health plans, that's something they look at, like, oh, neurosurgery, those Aetna patients keep getting readmitted all the time. Like, so all of it kind of connects. So, as NPs, as a supervisor, I kind of attend those meetings, and then I'm sort of the middle person to help translate and inspire my staff to like want to get on the bandwagon. So, something that we do now is we, after every surgery, patients go home, and you may think like, oh yeah, like we just touch base with our patients, but we've made it formal. So within like 7 days, we have an appointment on our schedule where we see the patients, and that is a time that we say, are you peeing? Does it burn when you pee? Because you're looking for UTIs, because that would be a reason someone would come back to the hospital. Wound infection, are you washing that every day? How are you washing it? What are you washing it with? Do you have a fever? And like, you really kind of dig in to, of course, support the patient, but also to support the greater initiative of like readmission rates. And so NPs really play a critical role in that. And that's just one thing. Like, we do like a million of those.
Yeah, and I think that's a good example too of like the difference between nursing and nurse practitioner is that the nurse practitioner is a higher level of nursing where you're starting to incorporate all these other things rather than just carrying out the orders. Now you're involved in it, you're involved in doing them yourself, and then the outcomes of each, and so it really,
like, you're being evaluated on that.
Yeah,
and they track it,
and so it really takes you to the next level and makes you kind of see a lot more bigger picture things that you don't necessarily see when you're just regular registered nurse.
Yeah.
Okay, so we'll go into the next. So why neurosurgery?
Why do we do this?
It's,
why do you do this?
It's high stress, but it's very, very rewarding. So brain surgery, spine surgery, it can be very stressful.
There's not room for error.
No room for error at all.
If you're 5 minutes late, if you're not 5 minutes early, you're late.
Yeah, or in the surgeons, if you're 1 millimeter off, it could change everything.
Yeah.
So it's very high stress for both us, the surgeons, the patients. It's complex cases, very intricate procedures that take a lot of thought and planning.
It's I don't know if like intellectual is the right word, but it's like you have to have like a constant curiosity.
Yeah.
With every patient.
Mm-hmm.
And you have to be fastidious as well. So what kind of personality gets drawn to that?
Crazy ones?
To be teased. I don't know.
And emotionally, just the patients, the families, they're going through a lot, obviously. And so that's all things that we consider when we choose neurosurgery and what we're getting into. But then
you have to be able to have the human touch.
Yes. We'll go to the next slide.
So along that. So I started this role a year ago, actually. And when I started the role, there was a ton of turnover. There was just like physicians that had moved on and NPs that moved on. And, it was hard, but it was such an opportunity to build a team that was fantastic and special, not like of our own, because the people who came before us were like knock it out of the park, amazing in their own way, but we were moving on in a slightly different direction. And for me, like I always said coming in, like whoever comes into this group has to be kind. Like I can't teach kind. You're going to be there for the patient, you're going to be there for other NPs. Like you either have that sort of empathic intuition or you don't. Like I can't teach you that. I can teach you glioblastomas, but like you've got to come to the table with that. Curiosity, I can't teach you to be curious, like that's something that you're going to have to dive into yourself. Like I don't want to be over your head saying like, hey, you don't really seem to understand cerebral bypass, like we got to talk about this. Like you're either going to kind of go for it or you're not. So that's sort of when we talk about like high stress environments, how we manage it, complex cases, emotional toll, like, in building a team, I really wanted to kind of have the real, true human fundamentals, because it gets crazy, it gets emotional, and it gets high stress. But if you're kind, you're curious, you're a team player, like all these sort of like innate things, we can do anything. And I think in the last year, like we've really built this fantastic team that I'm so proud of. I'm so proud of you.
No, but it's so true. And wherever you guys end up, those are key principles to not lose sight of. Because I think especially when you're in school and you're, trying to get all these things done, you have a million things to do on your list and you're really just trying to get through your day and this and that. Like, you don't want to forget about those things. You're choosing to go into medicine, whether it's nursing, doctor, something like any within the field, you're choosing to go into healthcare for a reason.
Just don't lose sight of it.
Exactly. So you don't want to
the job gets hard. You got to be around good people.
Yeah. And so addressing some of those challenges, stress management, mindfulness, debriefing, here in our group as nurse practitioners, Steph has helped she incorporated once a week. We have a meeting where we just kind of debrief and talk about what's going on. It's an area where if you learned something or there was a challenge you faced, you can talk about it. We can just talk about it so we all learn from it. Because if you messed up or there was a close miss or this or that, it's important to just talk about it and educate your peers, because it's a patient on the other line. And so
a no judgment safe space.
Yeah, and I think it's important to do that. And especially while you guys are in school, like, hey, like I almost didn't do this and it could have been bad. I'm so glad I caught it, but now I want to tell you guys all about this so that you think of these things too. It's a great area for that. And most hospitals do this, after a code or a challenging situation. A lot of times the medical team,
they do, like, even on higher level, they'll do root cause analysis.
Yeah.
Like there'll be M&Ms that you may or may not be a part of, morbidity and mortality rounds. But it's really important that you have a space, again, like when you're choosing an environment to come into, that those spaces are created as not a punitive space, but like a space for learning. And I also want to say with stress management, especially like after COVID, like a lot of the people who kind of made it through and stayed in the profession, like it's, just like a lot of weight that you carry around. There've been a lot of initiatives, especially at Lenox Hill. There's Code Lavenders, which is a time where it's a chaplain, it's a social worker, who really like whoever is on that day, like they come and they're available to help an individual or a team or nursing unit through a very like an emotional or an impactful, stressful time. Every Tuesday, there is like mindfulness in the hospital. There is a sound bath. There's meditation, and like a lot of people are involved. Like go to this, and we practice this in our office as well. I've been known to take out the sage. I sage before my office hours on Thursday. It's just, but it's that moment where I turn off the lights. Even some of my other, the other NPs in the office will come in. They're like, "Oh, you're saging." It's not so much about the sage, but more like, okay, let's take a moment. Let's breathe before our day. Let's think about what's ahead. How we know we're capable of getting through it. We're here for each other. And it goes such a long way, like that 30 seconds. So anyways.
And I will try and go quick because I know we're cutting it on time.
Oh.
But continuing education, it's incredibly important to keep up to date. Medicine is always evolving. So it's important to just keep up to date, especially when you're practicing. And, I think also use your colleagues, and if someone says something you're like, hey, I don't know what that is, like take a second to research it and understand. Or if you've been used to doing something some way and someone is introducing you to another way, it's always good to do that. But always be up and reading on the newest advances and treatment options. especially when patients ask you, hey, I heard of this, you know, a lot of times I'll get those emails like, hey, did you hear of this new treatment, especially in neuro-oncology? And sometimes I haven't heard of it yet, and I'll say, no, I haven't, but, you know, let me look into it and get back to you. And I think it's important to do that. And
Be humble.
Yeah. And
Humble
it's okay
and
to
open.
say, I don't know. And say, but let me, you know, look into it. Let me reach out to some colleagues, get back to you. Support system, you know, we've kind of like touched upon this the whole time. It's incredibly important. So just like interdisciplinary team wise, and also within your team, and ask those questions, you know, will I have a mentor? Will I have a support person? Things like that. When you're, you know, going into the field, you want to make sure you are aligned and have that, and use them.
Yeah.
So, and a day in the life, you know, we've really like talked about our days briefly, but the typical day for, you know, each of us varies. Here at Lenox Hill specifically, we have days with our surgeons where we're helping them through their clinics, but we also have days, you know, because we can practice independently, where we have our own clinic days and we're seeing our own patients.
Working them up for surgery, following them up. You know.
You might say, like, how do you guys have patients and they're not the surgeon's patients? But we get a lot of patients that have, you know, symptoms or issues, and we don't necessarily even know if they need surgery yet. And so here, you know, some of those patients will work up, or they have, you know, back pain with back issues, for an example, that doesn't require surgery, but we're going to try conservative measures first. Those are things that we'll handle. Or a brain tumor that was resected, and, you know, getting
Just
annual scans to just make sure nothing grew back, depending on the grading. Those are things that we'll do. Things like
yeah, and we have like administrative days, or, you know, research days, or there's not enough days in the week.
Not enough days in the week. So I know I threw a ton of information out there to you guys, just generally, you know, nursing, and then the different ways you can take it. As you saw in the beginning, you know, Steph took a very different route than I did to get to a very, you know, we're both here at Lenox Hill practicing as nurse practitioners, and I think it's mindful. Yeah.
But that's like, I think that's such a good point. Like, there's no, you know, I think sometimes there can be such pressure, like, I need to go to this school, or I need to get that kind of job, or, you know, and I think nursing's sort of the way, there's lots of different paths that you can take.
And then wherever you end up, you can stay there or not. But I think that's one of the very most precious things about nursing, is just all the opportunities out there. And like Steph brought up, you know, you can make it align with where you are in life at that time, and kind of evolve with it, and change and stop and go back. Yeah.
Be kind to keep your relationships.
Yeah. Does anyone have any questions?
I think, unfortunately, we are all out of time for questions.
Sorry, guys.
But thank you so much, Taylor and Stephanie, for sharing the various career paths for nurses, and about sharing specifically about your career in neurosurgical nursing. I am just so grateful to you guys, and your passion and commitment to educating students about nursing careers and pathways. So thank you again for hopping on today. You guys are the best.
I'm actually, someone just put, how could they reach us? And
so we'll just put our emails in the chat, just so you guys have it. But you can reach out to us anytime, and we would love to help.
Yeah, we often have, especially in the summertime, like, people come in and shadow. We, you know, are always up for a phone call. Like, you know, creating relationships and networking is all part of it. So we're here.
All right. Well, enjoy your last 2 days of brain turns, guys.
Thanks,
you.
Taylor. Thanks,
Bye.
Stephanie.
So much.